Hello, myself Parmar Maulik. We are talking about the skull fracture. Skull fracture is the topic of surgery. First, what is fracture? Any discontinuity of the bone, it's known as the fracture in the skull. Skull fractures mean in the discontinuity of the bone, skull bone, it's known as the skull fracture. Yes, it's a lateral view of the skull. We have a frontal bone, nasal bone, zygoma bone, maxilla, mandible, parietal, sphenoid, temporal, occipital, mastoid process, external auditory meatus. These are the 9 bones of the skull. It's the frontal view. In a partial, temporal, molar, maxilla, mandible, zygoma, nasal, frontal. It's all about the skull of frontal view. Then sutures. We have a mainly 4 sutures: frontal, sagittal, squamous and lambdoid. Then we have a skull fracture is any break in the cranial bone, also known as the skull. There are many types of skull fracture, but only one main major cause is the road traffic accident, trauma, head injury, major impact or blow to the head that is strong enough to break the bone. Symptoms that indicate a fracture. All symptoms of fracture are indicated like facial bruising, like bleeding, hematoma, like swelling, tenderness around the area of impact. Then we are going for the more symptoms. Like symptoms of skull fracture include swelling around the area of impact, facial bruising and bleeding from the nostril or else. Then types of skull fracture. It's depend on the there are different types of skull fracture, like each type depend on the force of the blow, like location, shape. Some cases injury to the brain can also acclimate the fracture. First we are going for the type of fracture depends on the force of the blow, location of impact of the skull, like ground. Different types of fracture lead to the different injury or trauma. Next, closed fracture. It's a very important to know about the closed fracture. Wherever the fracture line is not in the not breaking of the skin, without any breaking of the skin lead to the fracture known as the closed fracture. With the closed fracture, also called a simple fracture, the skin that covers the fracture area is not broken or cut. Then open fracture, discontinuity of the bone with the cutting of the skin, like also known as the compound fracture. And open fracture occurs when the skin is broken and the bone emerges. Then we are going for the depressed fracture. When the fractures occur and the bone is depressed like into the brain, it's known as the depressed fracture. This refers to a fracture that causes a skull into the indent extended of brain cavity. Then next, basal fracture. It's a very important or most commonly occur in the road traffic accident. It's very important fracture. Basal fracture occurs in the floor of the skull, the areas around the eyes, ear, nose or the face region. Back near to the spine. In addition to above types of fracture can easily as the linear fracture, means the linear line of the fracture or the base of skull fracture. Then green stick. Incomplete comminuted means 3 or more segment of the bone occur in the fracture line. Then next is basilar skull fracture. We have seen a 2 sign of the Dayton signs and Racon signs we can appreciate in the picture. Then cause of skull fracture. What are the cause to lead to the skull fracture? Skull fracture occurs when a force that is strong enough to the break in the bone of skull, known as the cause. Then like a beating hit by object, falling hitting into the ground, injuring head, a road traffic accident, any other type of trauma, open and depressed fracture as depending on the various types of force. Then next, symptoms of skull fracture. Symptoms, serious symptoms and less severe symptom. In severe symptom, we are having a wound, hypovolemic shock, injury to the eyes, nose, as ears, eyes, brushing around the trauma like a face, ear, severe pain in trauma site, swelling, redness, wound, It's known as the serious symptom, less severe, like headache, nausea, vomiting, blurred vision, restlessness, irritability, loss of balance, stiff neck, pupils acting light, confusion, fainting, excessive drowsiness. Then next, diagnosis of skull fracture. How can we diagnose a skull fracture? By a physical examination. We all know about the physical examination, then X-ray, MRI, CT scan. It's all about the diagnosis of skull fracture. Then we are going for the treatment of skull fracture. Treatment is the depending upon the several factors like a fracture line, like a severity of the fracture, then medical history, types of fracture, then resulting into the brain injury. It's depending whole treatment about the types of injury. In some cases, basal fracture medication control pain may be a painkiller like a non-anti-inflammatory drug. Then depressed fracture surgery may be necessary. We are doing a surgical intervention like a cranioplasty, craniectomy in this such cases. And then prevention, we are going for the prevention. Next, prevention of the skull fracture. How to prevent a skull fracture? Wearing a protective headgear while riding a bicycle or participant other sport in which head injury are possible, such as a football and rocking climbing, can prevent a skull fracture. It's all about the skull fracture. Thank you for watching.